speech therapist today.
It's nice to meet you.
Alright, so we have your case history. I see you've got a copy with you and everything, so that'll work. That's great. We're just going to kind of run through it. Just going to be evaluating Johnny today and for his speech and his language. And I'm just going to be asking you some questions, some follow-ups, just kind of to make sure I have all the information for your case history. And then, so after we do our little questions here, I'll spend some time with Johnny after that. And we'll get back with you after we do his evaluation. So it should take about an hour and a half total to do his evaluation and everything. So, so I see on your case history you're concerned about his speech development. Can you tell me about anything more about what's going on with that?
Yeah, he's not yet speaking words, and
Okay.
he's 2. He just turned 2, and he'll babble some, and like some sounds, not all, and some syllables. But it seems like it's kind of inconsistent.
Okay, so no, just nothing in particular that he is always doing.
No.
Okay.
And a lot of times he's just quiet.
Okay.
And he'll make maybe some vocalizations,
Mhm.
kind of like grunting, but
Okay. For the most part, he's just pretty quiet unless it's
Mhm.
something like that. Okay. So, when did you guys first notice? Was it you and your husband that noticed, or preschool teacher, or something like that?
yeah, it was me and my husband about a couple months after his first birthday. We just felt like, he should be talking by now.
Mhm.
There's something going on. And then we took him for a wellness checkup
Mhm.
about 6 months ago, and his doctor was like, oh, he's just a late talker, but we just had concerns about it.
Gotcha. Okay. I understand. So, has anything changed since you guys first noticed? Is he using more sounds, or is it getting worse, or is it just kind of staying the same?
I think it's mainly staying the same. It just seems to vary some. Like, he'll make a sound one day, but then maybe not make it again for another few more months.
Gotcha. Okay. Let's see. All right. So, do you think that Johnny's aware of any issues that he's having going on, or like if he's trying to get your attention or trying to get something? Does he understand if he is trying to tell you and he doesn't understand, or you don't understand what he's saying?
I think most of the time he's okay, but there are times, when he's just pointing or grunting, and I don't understand what he wants, and he seems a little frustrated.
Okay. So, let's see, I was looking on here. Has he had any other services from any other speech therapists? Has he seen anybody else or anything like that?
No, this is the first time we've sought professional help for this.
Okay. So, let's kind of go through your health during the pregnancy. Was everything good there?
Overall it was good. Had like some allergies and a little bit of high blood pressure, so I
Okay.
took medication for that.
Okay, good. Let's see. So I saw on here that Johnny was premature. He was a couple of weeks early, about 6 weeks early.
Yes.
And then, so he was it in the NICU for a little while?
Yeah, he had some complications after birth,
Mhm.
wasn't breathing properly, and had to have oxygen.
Okay, gotcha. Let's see. So you were saying that Johnny's had some ear infections and just some other kind of health problems.
Yeah, these have been pretty chronic: ear infections, sinus infections,
Okay.
upper respiratory, since maybe around 6 months of
Okay,
age,
okay.
and pretty
Wow.
chronic after that.
Okay. Did his hearing ever get tested? Was he? Typically they do it at birth at the hospital.
Yeah, that was done.
Okay, good.
That was normal.
Okay, good. That's what I was going to ask. Make sure all that was good. Has Johnny ever had any surgeries? I didn't see any of that on there.
Because of the chronic
Mhm.
ear infections, he had tubes inserted
Okay, when did he have his tubes put
about
in?
2 months ago.
Oh, okay, so that was recent.
Mhm.
Okay, all right, good. So let's kind of look through some of the rest of this. Did Johnny ever make any cooing sounds or babbling within the first 6 months, do you think?
I don't remember.
No? Okay, all right. So since he wasn't doing that, did he speak any first words, or is he using any words at all now?
No words,
No?
just sounds
Okay.
here and there,
Okay.
and syllables, babbling,
Gotcha.
some
Okay.
vocalization.
Yes. All right. So, for just kind of checking motor or anything like that, Was he crawling and walking around the time that you would think, would be normal, or, do you know around what age he was doing that?
Maybe around a year or so.
Okay.
Pretty normal. Maybe a little bit later than some.
Just a little. Okay. Did Johnny ever have any feeding problems or swallowing issues that you either noticed or the doctor noticed or anything?
Yeah, because he was premature there at the beginning, he had some swallowing and sucking issues.
Okay. Well, let me get that in here. Okay. Let's see. So you said that Johnny's in preschool. How often is he going? Is he there every day or just a couple days a week?
He's just there 3 days a week.
Okay. Have his preschool teachers ever said anything to you about being concerned about his speech or anything like that as far as his development?
Yeah, they've mentioned it a little bit, kind of reaffirming our concerns that we've had for him, but he's not in any sort of service
or anything there. Okay. Let's see. So you were saying that I was looking through the family history. Johnny's father had some speech therapy when he was younger.
Yeah, he had some problems with his sounds.
Okay.
Couldn't say all of them right.
Gotcha. Okay. Let's see. So, how does Johnny communicate with you other than just using sounds or anything like that? Is he pointing, or does he try to gesture, or using any sign language or anything with him?
Yeah, he said he's not saying words and quite a lot of the times, but he'll point to things, or clap his hands when he's happy.
Okay.
Some gestures.
Okay, good. Let's see. So, how does Johnny express his wants and needs? If he's just, grunting, does he just get things himself, or does he come and try to talk to you about it, or try to tell you even though he's not using words?
He'll sometimes, grab things, or he'll come up to me, kind of pull on my leg. When he's not happy, he'll cry or push things away, or point for things that he wants.
Okay, good. Let's see. All right. So you were saying he has some vocalizations with some sounds, but they're not consistent at all. They're just kind of, he's just
here and there.
Okay. So nothing.
Pretty quiet child.
Yeah. Okay. Let's see. Let me look. So how does Johnny respond when you're talking to him? Does he turn towards you and pay attention? Does he act like he understands what you're saying?
Yeah, I think so.
Okay. Good. Let's see. So, what about other people? Do other people, I know we've talked about the preschool teachers, but people outside of people that see him on a regular basis, grandparents or something like that, do they have the same sort of difficulty still understanding? Okay. All right. Is Johnny following simple commands? Just if you tell him to do something, does he understand?
Yeah, most of the time. Sometimes he seems like he gets a little confused, but if I tell him, go pick up your toys, he can do that.
Okay, good. Okay. So, are you, on the days that Johnny's not in preschool, is he just at home with you?
Yeah.
Okay. So kind of just give me an idea of what you typically would do with him on a normal basis in a regular day.
Usually in the mornings, I'm around the house, getting chores get done, and so he'll be, playing by himself. And then after lunch, I try to work with him a little bit, read to him, and work on trying to get him to say words.
Okay, good.
And then, later, as much as I can every night, try to read to him.
Okay, good. Let's see. So, how does Johnny play with others? Does he play really well with other people? Are there his friends at school or anything like that? Or does he kind of stay to himself?
He plays with the other children.
Good. Okay. So, are there any specific things that Johnny likes to play with? Any toys or anything that he prefers more than others? Or
yeah, he loves race cars, and so he has toy cars and plays with them on the racetracks, and he likes building towers out of blocks and things like that.
Okay, that's good to know. So that way, if you know, he does end up doing some more therapy, then we have some things that he can be rewarded with and different things like that. So that's good. Let me check through and make sure I've got all my questions answered, and I think we'll be good. So, yeah, everything looks good. I think I have all the information I need. It looks like your biggest concern for Johnny is just going to be that he's not speaking in words, and then that his vocalizations, if he is babbling or anything, it's kind of inconsistent. Is that right?
It just, you know, wanting to make sure, if, you know, that he can express his wants and needs.
Gotcha. Okay. Well, I'm going to take some time with Johnny. It'll be about an hour or so. We'll do his evaluation, and then for his speech and language. And in about a week or so, I should be able to get back with you with all the results and everything. So, all right. Thank you.